My name is Thomas M. Bosley. I'm the Knights Templar Eye Foundation Professor of Ophthalmology at the Johns Hopkins Wilmer Eye Institute. I do neuro-ophthalmology. I will see any type of patient with a neuro-ophthalmology problem. Neuro-ophthalmology, as you may understand, has to do with the aspects of vision that don't reside specifically in the globe. We have plenty of doctors at Wilmer who take care of the globe and do a wonderful job with that. We have neuro-ophthalmology to evaluate and take care of problems with vision that relate to areas behind the globe, in the brain, in the orbit, and elsewhere. That's been my interest now for 35 years clinically, and it has also been my research interest because I've published research in almost all aspects of clinical neuro-ophthalmology. In the last 15 years or so, I've become particularly interested in genetics and how genetics relate to human vision. In fact, there's a Bosley-Salih-Alorainy syndrome that my colleagues and I described a few years ago. This is a particularly important time to be involved in genetics because the power of our genetic tools, you may have heard, has absolutely leapt ahead in the last 15 years or so. Maybe 10,000 times more powerful than when I started in genetics 15 years ago, so that we can now sort out the genetic or partial genetic causes of problems that we couldn't have dreamed to have sorted out before. And that continues to be an interest of mine now that I'm here at the Wilmer Eye Institute. I've been extremely fortunate in my career and had the opportunity to do all sorts of different things in different places. I've taken care of patients. I've done a lot of research. I've had the opportunity to run departments as an administrator. I've taught residents and fellows. I've run residency programs. I've started residency and fellowship programs. Of all of those things, the one that I enjoy the most is taking care of patients. And that's why I still take care of patients, although I do the other things as well, including the clinical research. If you happen to have a neuro-ophthalmology problem, then I'd be proud to try to help out.